In the meantime, as of Monday, the state reported 84 new school-related outbreaks. 20 of those schools were in Oakland County, 12 in Macomb County, and 6 in Livingston County. And those outbreaks don't include any of the cases reported in the last 72 hours.
Those numbers are important to keep in mind as more young adults 16 and up get vaccinated. But as the sprint to end the pandemic continues, the question of children and immunity becomes more and more critical and a little contentious. 7
investigator Ross Jones with more on the vaccine trials and talking points surrounding kids and the shot.
Dr. Eric McGrath didn't need to think hard about getting the vaccine.
For me, it was a no-brainer to get the vaccine as soon as it was available, and the same for my wife, who's a nurse. But with kids, I think there's a lot of caution, concern.
And while vaccinating adults has been a priority for the last 3 months, the conversation is now turning to children.
I think I would like to give it to my children. It's just a matter of getting the information when it finally gets released, and then, sorting through it.
That information is starting to trickle out. Just last week, Pfizer announced promising news. A trial with children 12 to 15 years old was shown to be 100% effective in preventing infection. Moderna began its trial with kids under 12 just last month, and there are now signs that children may be eligible for the vaccine sooner than was once thought. News that feels promising, but also rife with questions and concerns.
I think a lot of people have worries around the safety of the vaccines for their children, but the vaccine will not be approved if there are significant safety concerns for kids.
But there are big questions that scientists are trying to answer.
One of the big things that has to happen for kids is we actually have to figure out the dosage.
And how children's bodies will respond.
The vaccines that we have, the mRNA vaccines in particular, are quite immunogenic, which is a good thing, right? That means that they elicit a nice immune response. We want a nice immune response. But they also come with other things like fevers, aches and pains, sore arms. And so the concern is, what is that going to look like in children?
Throughout the pandemic, we've seen how children can have different immune responses to the virus than adults.
We were some of the first people in the country, with New York and a few other states, to be seeing the multi-inflammatory syndrome associated with COVID-19 infection.
Thousands of children across the country were hospitalized with inflammation caused by COVID-19, known as MIS-C. Over 30 died, according to the CDC. And now questions about the vaccine in kids aren't just limited to figuring out the right dosing, but also navigating possible adolescent-specific reactions.
My fear from the very beginning was just, we need to make sure that these vaccines don't pose a risk for inducing that type of inflammation response.
There has been some concern, although I think a majority of experts think that it's extremely unlikely that the vaccine would cause that syndrome, but absolutely that has to be checked.
And while children have been far less likely to have negative reactions to a COVID infection, Dr. Gordon says they are still vulnerable. In just the last year, over 1,300 children have been hospitalized with acute COVID-19.
For a lot of people, I hear them say, yeah, but kids aren't at risk from COVID-19. Why do we need to get our kids vaccinated once all the adults are vaccinated? Isn't it just fine? And it's a misconception.
As the clinical trials continue, doctors remain optimistic that vaccines can bring an end to this pandemic for children and adults.
SARS-CoV-2 is not going away, right? You're going to get immunity one way or another, either through vaccination or infection. And really, to end this pandemic, we need to get immunity in children. And so that means we really need a vaccine for children.
And this week, Pfizer announced it'll begin to test its vaccine in children ages 5 and younger. To read more about vaccines in kids, head to our website at WXYZ.com. We're in Detroit. I'm Ross Jones. 7 Action News.
All right. Thank you so much, Ross.